Hi everyone, my name is Becca Scott and my group is going to teach you today about rotavirus. And I know you all have been dying to learn about it, so you are all in for a treat. So to start off, acute diarrhea was a major cause of worldwide death in young children. This caused severe dehydration in about 80% of patients admitted to the Royal Children's Hospital in 1973. A new virus was discovered in these patients by Ruth Bishop, Jeffrey Davidson, Ian Holmes, and Brian Ruck. This virus was found in the cytoplasm of mature epithelial cells that line duodenal villi in the intestine as well as in the feces. This virus is called rotavirus. Rotavirus is a virus that causes gastroenteritis. This is an inflammation of the stomach and the intestines. Rotavirus is a member of the family Reoviridae and the genus Rotavirus. Under an electron microscope, the virus looks like a whale with a 70 nanometer non-enveloped icosahedral or 20-sided structure. This is how rotavirus received its name. Rota comes from the Latin word wheel. This structure surrounds a double-stranded RNA genome that is enclosed in a triple-layered capsid. The virus contains 8 antigenic groups, or in other words, species of the virus, which are A through H. Group A is the main cause of gastroenteritis in children throughout the world, which is about 90%. A few major reservoirs for rotavirus are contaminated waters or food, inanimate objects, as well as humans that have become contaminated by human feces. Some examples would be changing a baby's diaper or using the restroom and not washing your hands. So, mom and dads out there, make sure that after you change your children's diapers, that you always wash your hands. Everybody knows that they should wash their hands after using the restroom, but we know not everyone does it. And even though our hands look clean, they aren't. It's pretty disgusting to think about how this is passed through fecal matter to the oral route or your hands to your mouth. Rotavirus reinfections are also common from touching contaminated objects or people and then placing your fingers in your mouth. It would be pretty sad to know that you were a parent who got your own child sick because you were changing his or her diaper, didn't wash your hands, and then your fingers touched their mouth, and that's how they got sick, and that's how the virus was passed. So always remember to wash your hands. And now Benedicta will tell us about signs, symptoms, and how rotavirus is transmitted.
Hi everyone, my name is Gabiano Akosia Benedicta, and I will be talking about the signs and symptoms of rotavirus and the transmission. Signs and symptoms in adults. First of all, we have dehydration, which includes decrease in urination, dry mouth and throat. You also feel dizzy when you try to stand up. And there are some instances you need to get into contact with your doctor when you can't take liquids down for 24 hours, having diarrhea for more than 2 days, have blood in your vomit or bowels movement. Also, when your temperature is higher than 102 Fahrenheit, there is also loss of appetite. As you can see in this picture, this is a picture illustrating an infected baby and also an infected adult of rotavirus. In children, you should also call your doctor if your child has diarrhea for more than 24 hours, has frequent episodes of vomiting, has black or tarry stools or stools containing bloods, has temperature or higher than 104 Fahrenheit or 40 degrees Celsius, has irritable pain, and they also experience dehydration, which includes dry mouth, crying without tears, little or no urination, unusual sleepiness, or unresponsiveness. So when you realize that your child is facing these symptoms and signs, you should quickly get into contact with your doctor for treatment. When a child is infected with diarrhea, severe and experiencing abdominal pains, it lasts between 3 to 8 days. So you should also take note of that. This is a projection of rotavirus infection in 1991 to 2006, and also you can see the projection that in 2007 to 2008 it has decreased. So I think there's an improvement, but we need to do more so that we'll be able to get rid of it. Transmission. Rotavirus is mostly spread among young children. Children can spread the virus before and after they become sick with the diarrhea. The virus can also be passed to family members and also with people that have close contact with the infected person. The virus is spread through fecal-oral route, which means that the virus is being shared by an infected person and then enters into a susceptible person's mouth to cause infection. The virus can be spread by hands, food, water, objects such as toys or surfaces. Thank you.
Alright, hi guys. I'm Mackenzie Long, and my group focused on rotavirus for our disease presentation. And I focused on the treatment, prevention, and control. Alright, so for the treatment, there isn't any specific medications that can treat for rotavirus, but doctors are able to prescribe medication that can treat only the symptoms. And there aren't any antiviral drugs that can treat this either. And then the antibiotic drugs don't help with rotavirus because they only fight bacteria instead of the actual virus. And then without the medications or anything, usually the infection will resolve within 3 to 7 days. So about a week. And then one of the main symptoms that rotavirus has is dehydration. And this is the number one priority. They said just make sure that you're not dehydrated, because this virus causes vomiting and diarrhea that leads to dehydration. And then children and older adults and other people with other illnesses are more prone to dehydration. And the symptoms of dehydration
are a decrease in urination, dry mouth and throat, and dizziness as well. And then in children, you'll notice they cry, but there's not that many tears coming out, little to no tears at all, and even more fussiness and sleepiness than usual, so people have to pay attention to that. And dehydration is the biggest concern that's preventable by drinking plenty of fluids, and rehydrates will restore the minerals that were lost to work more effectively than just water. So since all those minerals were lost from throwing up and with the diarrhea, it gets pretty nasty, and they'll have to restore all the minerals that have been lost. And then with diarrhea, if the diarrhea lasts longer than just a few days, then doctors will prescribe oral rehydrates such as Pedialyte, and that restores all the lost minerals a lot better than just drinking water can do. And if the diarrhea is severe, hospitalization may be necessary, and they'll be able to restore the fluids through the IV a lot quicker, so if it's that bad. And then the antidiarrheal medicines aren't recommended for someone with the rotavirus. And then for prevention, rotavirus can spread really, really easily, and even with regular just cleanliness, like showering, things like that, and just hand washing, that doesn't really help because it can still spread pretty easily. And the vaccine is the best way to provide for this, or to protect against this virus. And there's 2 different kinds that you can get, and there's Rotatech, and that's 3 doses given orally at the age of 2 months old, 4 months, and 6 months old. And then the Rotarix, which is the 2 liquid doses at age 2 months and age 4 months. And the clinical trials of both of these types of vaccines are detected that there was no increased risk of getting this virus after they received the vaccine. And then also there's home remedies with that as well if people didn't get the vaccine and ended up getting this virus. And in babies, you want to offer them small amounts of liquids, whether it be by formula or breastfeeding. And they also recommend that you don't dilute the formula, that you'll just put the rehydrate in there, but that you leave it just the normal recipe on there. And then for older children, you want to encourage them to rest and eat lots of bland foods like soda crackers and things like that, and to drink plenty of fluids plus a rehydrate with that too, and to avoid sugary foods, apple juice, and dairy, because that just really upsets the stomach. And then in adults, it kind of goes with the same with the children, where they need to rest and eat the bland foods, and also they can suck on ice chips to help settle their stomach a little bit, and make sure they're drinking plenty of fluids. And they recommended little sips of water, ginger ale, clear sodas or broths, and to also avoid fatty foods, caffeine, alcohol, and nicotine, because that really upsets your stomach and really kind of messes all that up. So that is for the treatment and prevention for rotavirus. So thanks for listening, guys.